This is the Art Beauty Podcast where we tell the real truth about the fake shit. I'm Amber, and today my fabulous co-host is Dr. Suzanne Levine. She is an aesthetic podiatrist, foot surgeon, and founder of Millennium Podiatry right here in New York City. And boy, has she trademarked some beautiful procedures, especially for our feet, including Stiletto RX pillows for your feet, which sounds delicious. The Loub Job, spelt L-O-U-B, like our favorite heels, and foot facial treatment. So we're going to be talking all about summer foot care. Welcome to the show, Suzanne.
Well, thank you for having me.
I'm so happy to have you here. So I don't know, our listeners are worldwide, but for those of us, who have seasons, I don't know about you, but, we're sort of in the throes of summer, and sometimes you take your shoes off, you look down at your feet and you're like, oh God.
Absolutely. This is a time of year we kind of undress our feet.
Yeah.
Take a look at them and you see these thick nails. You might have fungus from just wearing nail polish during the winter months, putting them in boots. You might have calluses back at your heels, calluses all over your feet. Your skin might be dry. And so your feet look older than other parts of your body. And all of a sudden you find yourself wearing these fabulous sandals and your feet look awful and they don't feel good.
Right.
And this is the time you want to really treat your feet the way you do your face. And that's my motto. That's why I became an aesthetic podiatrist. I want feet to look and feel as good as they can be. They have to last a lifetime. And
Right.
It's so important to take care of your feet. And that's why I ended up developing so many of these different procedures that help you walk better and feel better and make your feet look better. That's really important.
I mean, I'm going to share a little story with you. I have been wearing that nail polish on my toes forever. And I took my polish off. I had like half of my nail chip off and I freaked out because I thought it was fungus. I went to a doctor. They were like, definitely not fungus. But when was the last time you didn't have nail polish on? And I was like, 1997. I mean, really? But I had no idea that just by wearing polish all the time on your nails, it can really destroy your nails.
It can destroy it. And we have different lasers that we use that can actually replenish and actually get rid of some of the discoloration attributable to some of the dark nail polishes. So you can make the nails look better and healthier. And also put you on certain vitamins and obviously take you off the nail polish for some extended period of time.
Right.
So that's important. But you want to, first of all, make sure that you don't have a nail fungus. So many of my patients go and they think they go for a pedicure and that they're taking care of themselves. And in essence, what they're doing is exposing themselves to fungus because there might be a person before you that has a fungus and ultimately you end up with the same fungus. And it's very difficult to treat once you have it on the nails.
I've heard that's why I totally freaked out. My doctor was like, definitely not a fungus. Your nails have not breathed for like 20, 30 years. What kind of things can we do? Let's start there. If we're going in and getting our pedicures, what are we supposed to do? And how do we kind of avoid that getting a foot fungus?
Well, here's what I tell my patients. Firstly, you want to go to a place that uses these plastic containers.
Mm-hmm.
Okay, and they change them from client to client. Bring your own instruments, okay, and make sure that they sterilize their instruments. Make sure that they don't cut into the nails, the sides, so that you don't develop ingrown toenails. And, that they wear gloves and that the place is very sanitary. Look around, clearly if they're eating their lunch or if the place looks disorganized, it's not appropriate. You certainly don't want a place that does, that is not sanitary. That's most important.
When you're talking about the plastic container, are you talking about the plastic like wrap that goes into the tub?
Yes, I'm talking about each client gets a plastic wrap. It's only, yes. So, and it's removed from client to client.
And those work because the salon I go to does that, but I'm still like, don't run the jets.
Right. Don't run the jets because from client to client, you're going to actually, bacteria can actually from one patient to the next, from one client to the next. Warts can be transmitted from one client to the next, as well as fungus. So you don't want to set yourself up for that, especially with warm water. So you want to avoid that. And that's kind of key.
Do you kind of recommend maybe a dry pedicure?
Well, many of my clients do that, or they'll even have somebody come to their house. Or what they'll do is just have nail polish applied and actually take care of their feet at home. And we do something in the office called a foot facial, and where they're actually treated by a medical assistant, and the instruments are definitely sterilized with a hospital grade autoclave. And many podiatrists do that. They're trained by the International Aesthetic Foot Society. And that's an hour procedure. Calluses are removed with a sterile blade, and it's done by professionals, true professionals. And you do that about 3 times, 4 times a year. And there's just then go for a pedicure where you're getting a massage and you're just putting your nail polish on.
So
that
okay,
you don't run into these problems.
let's get into this foot facial. You mentioned, so we remove the calluses. Well, what else does that entail?
Well, it entails certain lasers that get rid of discoloration. We also use a special unit that a laser that penetrates the skin, the epidermal layer of skin, different exfoliants, foot masks, similar to what's a facial that you have on the face. So it is different instrumentation, and people are amazed that you can do all of this with the foot, and it feels terrific. So it's many different lasers that we use, products like Kojak and different kinds of salicylic acids, glycolic acids, things that only a physician can use.
Right.
And each patient is according to what the patient's skin looks like. If you have very thick callus, or if you have deep fissures, so it's really dependent on your skin type.
So now, okay, we know New York is always a little bit higher price, but can you give us a ballpark for what a foot facial costs?
It's $325.
Okay, right. So a little bit more expensive than your standard pedicure, but this is something you only need to do like 2 or 3 times a year, or 3 or 4 times a year.
Correct.
Okay.
And you can supplement that with a pedicure, just having nail polish and a massage, and avoiding some of these bacterial infections, ingrown toenails, and fungus.
So what are your thoughts, while I have you here, what are your thoughts on all of these like foot peels?
There are some over-the-counter products that they have that I think are too aggressive, much too aggressive, where patients come in and they go, "I'm so sorry, I used it. It's still peeling and it looks awful." And sometimes it removes too much skin so that you can feel so uncomfortable. So be careful with some of those peels. So it really is dependent on the patient. And sometimes people will have an allergic reaction. I find these products to be a little too aggressive.
I'm convinced that was what maybe helped part of my nail come off. I think that it actually kind of attacked the nail. I did one of those foot peels. I can't remember which one it was. It wasn't baby foot, but it was one of those sort of other foot peels, same sort of a thing. And the skin definitely peeled off. My heels look gorgeous. They felt soft for a while, but then my nail fell off. So to me, it's highly suspect.
Well, it could be that the products that they're using are so strong and aggressive, it was just inappropriate for your skin type. And, so one has to be careful. But I think people have to consider their feet and take care of their feet and, treat their feet. The majority of the patients that come in, especially patients that I see, do take care of their feet. And that's why I developed some of these procedures, the Loub Job, which is
I want to get into that. Yes. Let's talk about let's talk about the Loub Job. So what exactly is that? Again, spelt Loub, kind of like our Louboutins.
Yes. Well, I have so many patients that like to wear fabulous shoes, and especially post-COVID, and people getting back into their shoes. And then I used to the heel and a nice sandal, having pain in the big toe joint. And rather than think in terms of surgery or having to address a bunion, what we do is under a fluoroscope, which is a unit where you can actually see the joints of the foot. We inject a lubricant that actually lubricates the joint, and it makes it feel so much better, so that you're able to wear the heel, you're able to run. We do it on men as well as women. So it's not just limited to women, surprisingly. So a lot of our very athletic patients we do it on, as well as women that like to wear fabulous shoes. And I called it Loub Job because so many of my patients wear Louboutins, obviously. Right. And so they feel more comfortable in the shoe.
Now, how does lubricating the joint help you feel more comfortable in the shoe?
Because what happens is years of wearing heels, years of jogging, you wear away the joint, and that's what's
Okay.
causing the pain. It's almost like a traumatic arthritic condition where the joint is painful, inflamed. And by lubricating the joint, you feel so much better.
Oh my God, the things that we do for fashion and beauty, but God bless, because none of us are giving it up anytime soon. Um, what about now Stiletto RX pillows for your feet? Because I was imagining, when I wear heels, I don't have so much joint pain, but they just, it's like you don't have that padding sometimes on some of the fabulous shoes.
It's true. And you know what? This even happens in younger patients. I have patients that come in, they're in their late 20s and 30s, just the years of pounding, exercising, my dancers, people that are, really athletic, that are on their feet, that love to wear shoes, that stand all day. We wear down, the cushioning under the ball of the foot. And you may even on the back of the heel have a lot of pain. So what I developed is there's a material called Sculpture, which is a polylactic acid. And this is a material that cushions. We use it in other parts of the body. We use it for the face to build up the cheekbones. We use it for other areas to build up the
tush. They use Sculpture on the tush.
Yes,
it's an expensive procedure, but
correct.
It works.
Right. Some very famous people use it. In fact, they increased the price of the product because of them using enormous amounts. And it's a biodegradable product. I've used it over 20 years. I actually used it in Europe. It was called Newfill back then, over 20 years ago. So I'm really familiar with the product. And I have a lot of experience with the product, but it's a wonderful product if used correctly. So it cushions the bottom of the foot and it builds collagen. So as you keep using the product, it builds more and more collagen and you need less product. That's why I like this product if it's used correctly. And there's certain ways of injecting it appropriately. So it really is, it's a terrific product if used correctly.
If used correctly. Yeah,
yes.
Right.
And so I really like it. And then patients tell me, God, I can wear my shoes. I can exercise. I feel so much better. And I even use it when patients have botched surgery and they're putting too much weight. They might have a bunionectomy and all of a sudden they're putting too much weight on a second metatarsal, or they have pain elsewhere in the foot because they had poor surgery. So instead of doing surgery, we actually put some of this cushioning in the foot. And, they're just thrilled to have that. They go, oh my God, I can walk again.
Now, I have to ask on average, right? So we're going into this because Sculpture's, it's a pricey thing. Right?
Yes, yes. And when patients come in, they go, oh my God, it's so expensive. But it is the product that's expensive.
Right.
Many times, there are so many cases where I inject and, the product is equivalent to what I'm charging the patient. I just feel so bad. They might have had bad surgery and I will just inject. And there's times when I'm educating different doctors where I will have a day, patients will call me up and they actually come in for complimentary treatments. So the days that we do have once a year where we have patients actually line up. And so we have other doctors injecting under my supervision.
Oh yeah, sign us up for those. Hey, next time you need a foot model, let me know. So where does that sort of a procedure? What are the ballpark ranges for that?
Okay, it's $500 a syringe. And,
that's not bad.
No, it's not, because if one were to do the cheeks or anything like that, it's
like 12 or 1,300 a syringe.
Exactly, because it's done in the face. And it's a great product.
Oh my gosh, $500 is like half the price of one of these fancy shoes. So you might as well.
It depends now. If you're doing an entire foot, it depends how many injections you require. Some patients will require 2. Some will require just 1. Others might require, if they're doing the heel, if they're doing the forefoot, so it might go up to 4 per foot. But, it really depends.
And then how long does something like that last?
On some patients, I had one patient last up to 2 years. On some patients, initially it can be maybe 6 months to 9 months.
Got it. Okay. So really, again, when it comes to medicine and sort of these medical treatments, I would say that's pretty, it's definitely an investment in your feet, but it's not astronomical.
No,
Really, it's not.
I don't think so. I think going to having your face done, that the same product when injecting in other areas. That's when I'm
So
kind of
let me tell you,
pricey.
I have been saving money for since I hit my 30th birthday, but like I've got an automatic savings fund, and my banker called me and he's like, oh, so we're looking over your things and you have something called your PS fund. Like, is that something like for like cute gifts, like PS, I forgot this? And I was like, no, that's my plastic surgery fund for when I need a facelift one day, because that's expensive. And he's like, oh my God, I cannot even believe that. But you know what, peeps? Never hurts to start saving today. Right?
You don't look like you need anything.
No. You know, I'm 40, I'm going to be 43 in a month. Not yet, but it's, well, thank you. You look great too. But I feel like better to start saving now. And then that way, if I'm going to also say these days with technology and with the products and the way it's going, I'm going to say if and when we even need those, but it's nice to have that rainy day fund, you know?
Okay, well, I didn't think about that, but you're right.
Or it could be my podiatry fund, right? Your foot facial fund. So let's talk, you know, what are some of the most popular procedures right now that people are coming in your office?
Well, certainly the foot facial is so easy for people to come in for, and they feel better. There's a procedure that I do that's really, it's a bunionectomy procedure. People will come in and they're not as frightened as years ago when I did it in the 1980s. It's a smaller incision. It's not called minimal incision surgery, but the incision is far smaller than it used to, and you're using smaller instrumentation. And patients are able to walk after the surgery. No longer do you have to, yes, they're walking in surgical boots right after the surgery. And they're going back to work, you know, 2 and 3 days after surgery, which is really amazing.
And then how long do you wear the boot for?
You have to wear it for 4 weeks. Everybody, whether you're 18 or whether you're 80, 4 weeks, because it takes 4 weeks for the bone to heal. But you're able to do Pilates, you're able to do abdominal, you know, patients are able to walk, which is fabulous. And so I'm finding an increase in the number of surgeries that are done. And then also the use of orthotics. More and more patients are aware to avoid the bunion from developing. If the foot rolls in a lot, and if they find the arches are rolling in, if they're having pain in their feet, by coming to a podiatrist and using orthotics at a younger age, they're avoiding the bunion. So if chances are your mother has a bunion, you should probably see a podiatrist before. So maybe you could avoid developing the bunion if there's a genetic predisposition, where there usually is. And women are more prone to the bunion because of the lighter bone structure, hormones, and you know, muscle mass being less than a man. So, you know,
also some of the shoes we wear, right?
Yes, the shoes aggravate the condition, but by and large, a lot of it is hereditary.
Got it.
There's a genetic predisposition. You will see the start of it even in the 12-year-old.
Wow.
So yes, so I see young children come in and we're starting at 12 years old with orthotics.
Oh,
and it makes a big difference. It really makes a big difference, so that when they're 18 and when they're in their 20s, the bunion is not as bad and they may not require surgery, which is really fabulous.
You know, I've got some girlfriends who have bunions, and it's funny because I remember way back when I started my career, interviewing a podiatrist who was like, you know, if it's something that you want cosmetic, don't do it. If it's because you're in physical pain, absolutely you should get that bunion removed. But if it's just a cosmetic thing, you don't really want to mess with your feet. You agree with that still?
Absolutely, I agree with it. And when people come in and they go, well, I just want to narrow my feet. No, in all the years I've done it, I really have come to the conclusion, one should not do surgery unless you're really having pain and it's interfering with your activities of daily living. I really do. There's no reason to do it just for aesthetic purposes, unless it's your livelihood. You know, it would be absurd to do that.
Oh, gotcha.
So, I mean, but the majority of patients always come in and say, you know what, this is bothering me. I have pain in my shoes. I have a difficult time walking. I can only walk, you know, 4 blocks. That certainly is interfering with your activities of daily living. which
Yeah.
is why then we address and say, well, at that point, it makes sense to have surgery.
Gotcha. So really the takeaway is like when it comes to your feet, because on this podcast, obviously we talk about plastic surgery and procedures. But when it comes to your feet, aesthetically, surgery is not a good option.
No, I think that what we do in my office is I see a lot of patients that have had surgery and they have these huge scars. And then what we do is we have several lasers that we use here to get rid of the scars, to minimize the scars. We have something called the Opus. We have some of the state-of-the-art lasers, mesotherapy, which I'm sure you're familiar with, radio frequency. So I have state-of-the-art lasers, which very few podiatrists will invest in, because I see these enormous scars on the foot. And they're not a pretty sight. And especially for women of color, it looks awful. It could be hypertrophic, the scar could be large. And when they look at the scar looks worse than the bunion.
Oh,
So we try to really minimize that.
got it.
And that's kind of key.
Do you have any general, we are in the throes of summer right now. I know that we talked about sort of what to do at like a pedicure place. Do you have any other just good general summer foot advice that we should be following?
Yes. And one of the things I tell patients is don't wear your flip-flops every day to work. Try to avoid wearing very flat shoes because the foot ends up widening. And it's not good for your arch. You'll end up with a heel plantar fasciitis. You'll end up with a neuroma pain. You need that arch support. That doesn't mean you shouldn't wear a flip-flop when you're at a beach. But if that becomes your everyday shoe, you're going to end up with problems. So you have to avoid that. I really do believe. Or the very flat sandal, which I know everybody loves to wear. You should not be walking around with that for 8 hours a day.
You're breaking my heart right now because I have a pair of Valentino flats that I wear. That is my summer shoe. But really, I work from home, so I'm not wearing it all day, every day. But
that it's not a good idea. I know they're fabulous looking. It's just not great for your feet. And you don't want to talk about aesthetically. You don't want that foot widening. When I don't want to see you and you're going to say, "Oh my God, look at my foot got wider. It got longer." It's not because your foot is growing. What's happening is the ligaments are starting to become lax, and due to gravity and no support, what's happening with the foot.
So on that note, do you have a favorite pair of shoes that you like to recommend to people that you're like, wow, not even fashion forward, but like,
I think that everybody has a different kind of foot type.
okay.
You can have a high arch foot. That's like, it's not one size fits all. It's a different body type. If you try on a dress and if you have a fabulous waistline, you're not going to wear a dress that's, full.
Right.
Everybody's foot is so different. And when someone says, what shoes do you recommend? It really depends on the foot type. There's a foot type that's called a cavus foot, a high arch foot. Then you want a shoe with a lot of cushioning in the front. Then there's a foot that's very pronated, a very, flat foot. So it really, really depends. And there's so many different foot types. So
gotcha. But I know that you are a fellow New York woman and we walk a lot here in New York. So what is your summer commute shoe?
You know what? I like to wear actually sneakers. I tend to wear, but I don't even want to tell you the brand of sneakers. That's where I have to put money aside. I like.
No, tell us. Now you have to tell us. What are they? Come on.
Okay. Well, I do have a pair of Chanel sneakers.
Oh, I love it. Great. Perfect. We celebrate that.
Okay. So, I invest in shoes and sneakers. So most people invest in jewelry, but I have over 300 pairs of shoes. So
oh my gosh. You're like Imelda Marcos.
Well, I would love to have some of her shoes, but no, I do. I love shoes and sneakers, and I do find that they're better made, the higher quality.
Yeah.
And they, they're well constructed, but I do look for something with a good arch support. And clearly I like all of the glamour and what they aesthetically are really pleasing. And some of the sneakers are fantastic because they have some of the inner soles. And I also like something with a little height since I'm vertically challenged. So I just like cool sneakers.
I love that though, because sometimes with some of these luxury brands, you believe it or not, you would think that they'd be more comfortable, but sometimes they're not. So it's good to
Right,
know
they're not.
Chanel.
You have to really look right. It's not just about the brand.
Right.
Certain Chanel's sneakers might not be appropriate. So it really depends. But I look for a good support system and a good, heel wedge. Many of them have wedges where you really feel kind of comfortable. My foot does well with a wedge and a good support system. I don't like sneakers that are very flat. So, that's what I kind of live in. And then I like sandals, some really fabulous looking sandals. But I tend to go for higher priced items. I like breathable material, leathers that are really fine leathers. I find it's best to invest in a good pair of shoes.
I love that. I celebrate it. I want to thank you so much, Dr. Levine, for being on the show today, for sharing your summer tips. If people want to know more about the Loub Job, about Stiletto RX, pillows for your feet, if they want to know more about your foot facials, where can they find you?
They can go online, Millennium Podiatry NYC, and we'd be more than happy to answer any questions. And if anybody has any, if they'd like to make an appointment, or they can call us at our office.
Amazing. She's located right on swanky Park Avenue. And if you have any questions that you want me to pass on to Dr. Levine about any sort of summer foot question, I'm always happy to do that. You can email me at hello@artbeautypodcast.com. You can find us on Facebook, Instagram, and YouTube at Art Beauty Podcast. And as always, we will see you next Tuesday. Bye.